Welcome back to Talk of the Town. Joining us now, as promised, we've got an interesting topic that we're going to cover here. We've got Eric Hewitt, who is the owner of the Medicine Shop in Monona, and we are going to talk about specialized medication packaging. So there's a lot to know, and Eric, I'm glad you're joining us. Thank you.
Thanks for having me.
Yeah, so I've got a lot of questions about this. This is an interesting topic. Now, for folks out there who are wondering about some different options out there, what are the different packaging options for patients and caregivers, and how do these help ensure that we're getting the right medications?
Sure. Yeah, at the Medicine Shop, we have a couple of different options, to help keep, maybe family members or the patient themselves independent in their own homes while having the safety of having proper medication set up. So I brought a couple of things here. We have kind of two options that we have here. So we just have the normal med box that can be set up for a week. We pre-fill this med box with the medications in the correct slot, and we would deliver those to the patient's houses on a weekly basis.
Okay.
So it kind of takes responsibility off of you, the patient, or you, the caregiver, on setting up those meds, and we do that for the patient themselves, and like I said, send that out to them.
That's great. Foolproof.
Yes,
yeah.
Can be. We try. And then kind of the next step up would be the CompuMed, and basically this is something similar, only the medication box gets locked in here, and there is a audible reminder of when to take the medication. So we can set it up to multiple times a day. This little light goes off here, and a tray pulls out with the medications they're supposed to get. So this kind of helps. It's kind of an extra level of security for people maybe that forget to take it, don't remember what day it is, that kind of thing, or even have trouble, kind of duplicating medications even though it's set up for them.
Right, absolutely. So depending on what sort of level of automation you're in need of, that is an outstanding option.
Yeah.
And let's talk a little bit about why somebody might choose to do this is the CompuMed, is that how it's pronounced?
Yep.
Why would you choose that over the weekly
Sure.
option? What would be the most reasonable reason?
Most of the time, for most of our patients, it's kind of a dementia or a memory kind of situation where, something like this, even though the medications are set up, they may not know that, today's Tuesday, or it's Tuesday in the afternoon, or if they see a slot that's empty, they think maybe those pills are missing, they don't remember taking them.
Sure.
They also have access to a full week's of medication at a time, where the CompuMed kind of locks it in, only dispenses the medications that they're supposed to take at that given time, and doesn't give them access to anything else.
Wow, okay, so this is very important for somebody with memory issues, memory loss, things of that nature. And can we get this at any pharmacy, or how do we go about getting something like this?
You can always check with your local pharmacy. A lot of times the smaller independent pharmacies like the Medicine Shop will have some sort of med boxes or medication packaging that they do. The CompuMeds, however, to my knowledge, we're one of the only pharmacies in southern Wisconsin that has the CompuMed. They may have some similar kind of more specified packaging compared to just the general med box, but to my knowledge, we're the only ones in southern Wisconsin with the CompuMed machines. And
one question that comes to mind is, this is just such an outstanding and important piece of technology for folks who are in need of something like this. What if the medication is changed in just that day? How is something like that handled?
Sure. Yeah, because most times these boxes or the CompuMeds will be delivered on the same day each week. So say it's Tuesday and tomorrow they change a medication. For us at the Medicine Shop, what we do is either myself or one of my delivery drivers will come out and change the box right there. So it's not something that the patient has to bring in to us or the family has to somehow arrange to get there. Because these are a locked med box, we have to have access to them. So one of my staff members or myself even will come out and make sure that change is done in a timely manner so the patient can start on the new medication or an antibiotic or whatever has been prescribed for that patient.
Wow, that's really outstanding. That's service. And are there any limitations to either of those options that you want to share?
Yeah, the limitations for the CompuMed is, number one, you have to be home when it dispenses.
Sure.
And then number two, it can only be programmed for up to 4 times a day dispensing. So in the rare case that somebody may take things 5-6 times a day, we have to either try and consolidate some of those doses so it fits into 4 doses per day. So that's really kind of the biggest limitation, is the fact that you can only program it for up to 4 times a day to dispense.
Interesting, but what an important way to get medicine to our loved ones who are struggling with memory loss or just need the reminder. So that's very interesting. And Eric, thank you so much for joining us from the Medicine Shop in Monona. These guys are a wealth of knowledge, lots of information, and I know there's a lot more where that came from. So thanks for sharing just a little bit of your knowledge with us. We appreciate it.
Thanks for having us.
All right, guys, stick around. We're going to be back with more Talk of the Town right after this. Don't go anywhere.